Now, the first new option we're offering is called Mask to Stay, and it applies to participation in the classroom following a COVID-19 exposure in a school setting or another school-related activity. Direct contacts, regardless of vaccination or masking status, may remain in the classroom environment if they do the following. First, wear a mask for 14 days after their last date of exposure. Second, self-monitor or parent monitor for symptoms of COVID-19. Third, isolate and get tested if they start to experience symptoms associated with COVID-19. And that would be regardless of the severity of those symptoms. And fourth, consistent with guidance for others quarantining in low-risk environments, students and staff may discontinue these quarantine procedures after 7 days if they meet two basic criteria. First, they don't develop any symptoms. And second, they test negative between days 5 and 7. This is the so-called 7-day quarantine option that has been in place for a very long time. While parents and students are responsible for symptom monitoring under this guidance, if a school staff member or school nurse sees a child exhibiting symptoms, they should, of course, act accordingly. The second option, which we're calling Test to Play, applies to participation in extracurricular activities following exposure in the classroom or the school-related environment. Asymptomatic contacts may continue to participate in extracurricular activities if they, first, wear a mask when able. This includes wearing a mask during transportation, like traveling on a team bus, traveling to and from the game, while in a locker room, while sitting or standing on the sideline, anytime that they can reasonably wear a mask. Anytime that the mask won't interfere with breathing, the activity that they're engaging in, or create a safety hazard. Secondly, we ask them to test on initial notification of exposure to COVID-19. So right away, once they've been advised that they have had a direct contact. And then third, test again, sometime between days 5 and 7 following that initial exposure. Now, if they're negative at that time, between days 5 and 7, they of course qualify to test out of quarantine after day 7 and can resume normal activities.